We are going to talk about pain during breastfeeding. And you can guess why it's important, because anything that causes you pain, you don't want to do it. So in order to make your breastfeeding as painless as possible, we are making this video to talk about the things that can cause you pain while you are breastfeeding. So the first thing that can cause you pain while you are breastfeeding is the letdown. The letdown is the feeling of milk rushing out of your breast into your baby's mouth so that your baby can get food. In a lot of women, they just feel a tingling sensation. It's not pain. But some people also report some pain. Well, this one is not severe enough for you to do anything about it. And you just sort of get used to it and you don't even remember that it is happening anymore. So that is the letdown. The next one to talk about is engorgement of the breast. When your breasts are engorged, they feel full and heavy and they are painful. It is general, the whole breast is painful and not just a part of the breast that is painful. There are two periods when you can get breast engorgement. The first is the early days after you have delivered your baby. When you have delivered your baby, usually it takes a few days for your breast to get full. So a lot of women will have their breast full from day 3, day 4, day 5, then they have their breast very full. And in those initial days, the babies don't feed much because their tummies are small and because they are also learning how to breastfeed, and you are also learning, both of you are learning, so they don't feed much. So usually there's a lot of milk in your breast at that time and it is engorged and it is painful. What can you do about this engorged breast? If it's painful enough, ask your doctor. Or not if it is painful enough. It's painful. You ask your doctor to give you some paracetamol that you can take for the pain, and then it will go away. You can also use a warm compress. You can just put towel in warm water and put on the breast to help the milk to flow out. And then you can express the milk. You can use your hand to express it, or you can use a breast pump. Now, there's something to say here. If you want to do exclusive breastfeeding, then at this time that your breast is engorged, you need to empty the breast, and then more milk will be produced. You empty the breast and more milk will produce. This helps you to get a lot of milk for your baby in no time. And the milk that you have expressed, you can throw it away if you like, or you can store it because perhaps you will go to work and your baby may need that milk. But there are some women who unfortunately lose their babies soon after delivery. In that case, or even if you haven't lost your baby but you don't want to breastfeed, in that case, what you need to do, when you express the milk, don't empty the breast. Just express enough for you to be comfortable and you can throw it away. The next time your breasts are engorged as well, you express enough for you to be comfortable and then you throw it away. So warm compress and express the milk in any of the two ways that I have mentioned. This is what you can do. But later on, even after your baby has gotten used to breastfeeding, your breast may get engorged if your baby has gone for a long period without breastfeeding. Maybe your baby has slept for long, or you have left your baby at home and gone somewhere. That can also give you engorged breast. Again, the same thing, a warm compress. And then if you have come home, feed your baby, or you can express it and put in the freezer or the fridge, depending on how long you want to keep it, and then your baby can have that later on. So that is how to deal with the pain of breast engorgement. The next one is nipple pain. So nipple pain is the pain that you feel in your nipple when your baby has not latched onto your breast well. When we say latch, we mean the way in which the baby's mouth is holding your breast. A good latch is that your nipple is deep within the baby's mouth. The baby's lips should not hold onto your nipple. If your baby's lips are holding onto your nipple, that is a poor latch and you're going to feel pain. So that should not happen. So a good latch is your nipple is deep within the baby's mouth. And the areola, which is the dark part of the breast that surrounds the nipple, about half of it is also within the baby's mouth. And the baby's lower lip is turned outward. That is a good latch. And that latch is not painful. So whenever you put your baby to the breast and there's pain in your nipple, it means the latch is poor. What you need to do is to stop the breastfeeding and reposition your baby so that you get a better latch. If you have difficulties, ask your nurse, your midwife, or your doctor to help you so that you get a good latch for your baby. Related to nipple pain is the pain of sore nipples or cracked nipples. So when nipple pain, which is caused by a poor latch, is not attended to, when you don't get the help that you need, then this can result in your nipples becoming sore or cracked. We don't want that to happen because it is painful, but sometimes it happens. Like I said, you may not get the help that you need. When that happens, again, what you need to do is the latch. You need to find a good breastfeeding position so that the latch will be good. And for the sore or cracked nipple itself, get some pain relief like paracetamol that you can take, and it's safe for your baby as well. You just need to take it in the correct dose. So you can take some paracetamol. And then you need to treat the nipple. The way I recommend, and a lot of people and authorities recommend, is that after you have finished breastfeeding, you express a little breast milk and put on the nipple and let it dry on it. So the breast milk has all these vitamins that help the wound to heal and not get infected. So you use the breast milk to dress the sore or the cracked nipple. You can also put lanolin on it, because sometimes when it's really cracked, it can get stuck to your brassiere, and when you want to remove it, then it's painful. So you can also put lanolin on it. But I think some people have lanolin sensitivity, and then also in addition, breast milk is freely available. It's safe. Your baby can swallow it. So I recommend that you dress it with breast milk and then you just let it dry. So that is how you can manage sore nipples or cracked nipples. Then the next source of pain during breastfeeding that I want to talk about is clogged ducts. So the breast that we see is divided into segments, and there are small pipes or tubes that take milk from the segments of the breast into and coming out of your nipple for your baby to take. And just like any ordinary pipe, those pipes called the milk ducts can also get blocked or plugged. So when you don't remove milk from those pipes or the milk ducts, then they can get blocked or plugged. How do you know this has happened? You will find a lump in your breast, and you may also find that there's this white bulge on your nipple. So what should you do about it? You need to relieve the blockage or the plug that is in the milk duct. So when you are breastfeeding, let the baby's chin face that lump that you are seeing. And you can just use your hand to gently massage that area as your baby is feeding for the milk to come out of that duct. The other thing you can do is to put a warm compress on it to help the milk to flow out of that duct. But to prevent it, the way to prevent it is that you make sure that you are breastfeeding from different positions so that your baby can remove milk from all these parts of the breast. So breastfeed sitting up as I am doing, breastfeed reclining, so you find a chair or you use some pillows to support you so that you can recline, and then breastfeed lying down on the side. When you do these things, it helps the baby to remove milk from all the segments of the breast, and then no ducts will get plugged. Also, when you are breastfeeding, don't wear tops or dresses with tops that are very tight, because when the baby is feeding, they can compress some of the ducts and milk won't flow out. And don't also use brassieres that are very tight or have underwires under them, because of the same reason. They prevent the milk from coming out of those ducts, and the ducts can get plugged. If it is a plugged milk duct, when you do these things, it should get relieved and there should be no lump. But if a lump persists in your breast even after doing these things, you need to see a doctor. And the reason you need to see a doctor is that any lump in a woman's breast that is not going away, we must make sure that it is not breast cancer. So if they have this lump, even when you are breastfeeding, you think it's a plugged duct, you've done these things and it doesn't go, be sure that you have seen a doctor. A breast abscess will develop if you have a plugged duct that you haven't attended to, or if you have breast engorgement that you haven't attended to. When you have a breast abscess, you will feel sick. You will have a temperature, or your temperature will be high. You will feel feverish, as if you have had a cold or some other sickness. And you will find a part of your breast that is very painful, it is very hot, and if you are fair, that part of your breast may begin to look reddish. But of course, if you are very dark, then it may not look reddish. You must go to hospital for this. because in some cases the abscess needs to be drained and you need to be given antibiotics for this. And then you also need bed rest. When you are sick, you need to rest because you are sick and you have a baby to care for. You need to rest. But you need to continue breastfeeding because you need to keep draining that breast. This breast abscess was likely caused by you not removing or your baby not removing milk from the breast very well. So you need to continue breastfeeding and take pain medication as well. We don't want you to have pain. That is why we are doing this video in the first place. So make sure that you have pain medication. Then the next one to talk about is thrush on your nipples. When you have thrush on your nipples, breastfeeding is very painful. The pain is from deep within the breast, and even after you have stopped breastfeeding, you may have this pain for up to even an hour. So nipple pain is there when you are breastfeeding, and once you stop breastfeeding, baby lets go of the breast, it just goes away. But for thrush, even after you have finished breastfeeding, it is there. The pain is very burning. It's from deep within the breast. And you may find changes on your nipple as well. Your nipple may flake, or there may be some blisters around your nipple. The nipple will be red and shiny. So thrush happens when a fungal infection comes into a cracked or a sore nipple. Usually this is from the baby's mouth, because a lot of babies have thrush just because they are babies and their immune system is not that very well developed. So when a baby has thrush, you find this whitish thing on their tongue, in the inner side of their lips and their gums. When you clean it, it doesn't go. When the tongue or the mouth is coated with breast milk for a baby, when you clean it, it goes. But for thrush, it will not go away. And sometimes you may notice that it has come after the baby has used antibiotics. So when you find that in your baby's mouth and then this is happening to your breast, know that it is likely to be thrush and you need to go to hospital because this needs to be treated. You need to be treated and your baby needs to be treated as well, because if only one person is treated, then the other person can give it back to the person. So the mom can give it to the baby or the baby can give it back to the mom. So both of you need to be treated. You need to go to hospital for this. And to prevent thrush, thrush is a fungus and it grows when the environment is very moist or watery. So to prevent thrush, make sure that your brassieres don't get very wet. You know, when you're breastfeeding, usually your brassiere will get wet because as you are breastfeeding from one breast, the let down milk is coming from the other one. Or you've gone somewhere and you've seen a baby crying and the milk just rushes into your breast and your brassieres gets wet. So you need to change your brassiere frequently. Wash them, dry it in the sun if there is the sun, or otherwise then you need to treat them just like you would treat your underwear. You may need to iron it if it is ironable, or disinfect it for that. And then the breast pads too, as soon as they are soaked, you need to change them because otherwise you can get thrush. Then the other source of pain is back pain. Back pain will happen to you when you are breastfeeding and you adopt a posture that is not good for a long period. So one of the main causes of back pain in many mothers who are breastfeeding is that they hunch and then they breastfeed their babies. They hunch and take the breast to the baby. But what you should do is to bring the baby to the breast. Initial days when the babies are small, you may need a pillow to support you. And even with the pillow, if you don't have like a cesarean section wound, you may need to still raise it by putting one leg on top of the other so that the baby can come to the breast. And you can lean back and be comfortable and breastfeed. But if you don't do these things and you keep hunching to breastfeed, then you are going to find pain in your back. So just make sure that you look at the position and don't adopt an unusual position for so long, and exercise your body and your joints, and so that you don't have this kind of pain. So these are the causes of pain when you are breastfeeding. If I have forgotten any other cause, or if you have breastfed and you have felt some pain that you think is from something that I have not talked about, please put it in the comment section, because we all want to learn. We want as many people as possible to benefit from this. If you found this video useful, then share it, like it, and subscribe if you have not subscribed. Thank you so much for watching this video.